secondhand smoker smokes all of that, or sniff all of that, or inhale it.
Yeah, no, actually, when the smoker exhales, they kick out whatever they could not absorb, so they absorb the most of it already.
Okay. Again, we are live downtown Wichita, KCTU, Channel 5 with Dr. Asim Farhat. If you would like to be part of the show, please call us at 267-8855, 267-8855. Questions in relation with, I want to go back to the issue of alcohol. I know from, we're not talking about the lawful or unlawful of it, but how does it affect the heart itself or the lungs? I'm talking about medically, chemically, poison. How does it affect? I mean, is it just like a chemical that does an imbalance to the body, or how does it affect?
Yeah, I mean, it seems like alcohol affects the heart in several ways. One, as a chemical substance, it can have a direct effect on the energy system of the myocyte, or the cell that forms the heart, the unit of the heart muscle. Mm-hmm. So there's a direct effect on the energy organelles within the cells. The second effect, and that leads to disability of the cell, and then you develop cardiomyopathy, we call it, or enlargement.
So
of the
does
heart,
it like kill some cells, or
it kills the cells?
It kills some cells in the heart.
And the second effect is that through stimulating rhythm problems. Mm-hmm. And I mean, those are the major bad effects. And like I said, there's some beneficial effect as an antioxidant.
Mm-hmm. What about, when I say drugs, I mean medicine. Mm-hmm. Some drugs may affect the heart itself, like side effects.
Yes, I mean, there are many drugs that can affect the heart. Oh, yeah, there are many drugs.
So how do you deal with these issues as a cardiologist?
Well, it depends on the condition. Mm-hmm. I mean, we do get patients who are taking certain drug for certain condition, and when we see that the heart condition that they have may be caused by that drug, we usually stop it.
Okay. I want to take a commercial, by the way, and we'll come back. We have a lot of questions tonight. We are with Dr. Asim Farhat. He's a cardiologist here in a group with a group here in Wichita. We're going to take a commercial break, and we will be back. Please stay tuned. Welcome back, and we are with Dr. Asim Farhat, cardiologist in Wichita, and I have on the line, I believe, Shonda. Shonda, good evening.
Because I had a comment.
Shonda?
Yeah.
Good evening.
Good evening.
How are you?
Okay, I'm just a little nervous.
It's okay. What do you got for us?
But I was just asking, my daughter started taking medication for epilepsy, and it actually really did make her gain a great deal of a lot of weight. Mm-hmm. And around this time is when I start hearing them talk about obese kids and stuff. And I believe that most of the kids that I know that is on any kind of medications, the medications has caused them to be obese in a great, in a large way that is really not talked about. But the other thing is that she also has a gastrointestinal issues like GERD that she deals with. And I thought that you can catch diabetes from not having enough food to eat and not being able to afford healthy food, healthy foods like fruits and stuff. And so a lot of times when I go shopping at the store, I get what I can afford, you know what I'm saying, or what's on sale. And that's how I have to shop because I'm on a, somewhat of a fixed income. Mm-hmm. But I was just wondering, why is it that, they leave out the part about medication causes a lot of obesity and not having enough to eat also causes diabetes and heart problems as well, So not having enough of the healthy food.
So the main question, why some medicines do cause some heart diseases maybe or other problems to the body?
Yeah. Why is it that we don't talk about the weight gain that medications cause? Because around the time that she was taking this medication, they started talking about obese kids, and she blew up like a shit. But once she came off of the medication, the weight dropped off of her. But while she was on that medication, she had gastrointestinal problems, she had bowel problems, problems with going to the bathroom, and this was all related to medication. And the other thing is that the doctor told me to keep an eye on our sugar level. He never said we was diabetics or nothing. But I was saying that I also heard that you can catch diabetes for not eating enough. Not eating at least 3 times a day. You know what I'm saying? Breakfast, you got to eat breakfast, and then having some type of snack or something for lunch, and then eating a healthy dinner. That is something that is a necessity, and so sometimes I feel like a lot of these problems are kind of created because of a lack of care for health care for everybody.
Well, let's talk to Dr. Farhat.
The caller's question. The first question is about medications causing weight gain. It's true that there are certain medications that can cause weight gain. Mostly those medications such as steroids or hormones or certain medicines that interfere with the growth or with the appetite or with the hormonal changes within the body. No question that some of those medicines can make a person gain weight. The problem, however, that we're seeing is that the great majority of kids or teenagers that are overweight are not on those medications. They are a certain percentage that are taking medications, but it's really relatively small percentage. On the other hand, even when we or some physicians prescribe those medications, obviously they are prescribed for a condition or conditions that require that kind of medication. And we always try to counsel the family and the patient about that possibility so they can watch their diet much more carefully. It's just trying to find what the risk-benefit ratio. So I agree with the caller, there are some medicines that make you gain weight, but the minority of teenagers that are overweight nowadays are taking those medications.